In New Mexico, it's Governor Lujan Grisham, and I want to thank you for joining us again for our weekly COVID-19 briefing. And I want to point out that we're wearing homemade masks that were made for many of the governor's staff and myself, and I want to thank Jody for doing that. And we're wearing them, and I'm going to take mine off so you can hear me clearly, to demonstrate that we take this very seriously about mitigating risk and exposure and transmission. And I want to announce that we've got so many volunteers, and we need more, who are sewing masks, and our goal is to make them widely available for any New Mexico resident or family who needs them. And we do think that it is a best practice tool, and we want to encourage and model the right kind of COVID-19 mitigation behaviors. So with that, and I want to thank the cabinet secretaries who are wearing their masks, and most of the folks who are helping do the video work for this briefing are also wearing masks, and frankly, they should. So I want to thank everyone for doing that. So we're going to do the same format that we've been doing every week. I want to start with giving you a case update for the day, and I think we've got a slide that does that. We've got a total of 989 cases. We announced 124 new cases today, with one new county, Colfax County. I think, unfortunately, what this demonstrates is that we have community spread statewide. And we worked to really do everything we could to minimize that potential and to mitigate. It is, in fact, something very difficult to do. We've got national community spread, but we want to make it very clear to New Mexicans. Community spread is occurring, so you have to do more to minimize transmission. I also want to talk a little bit about hospitalizations. We have 73 individuals in the hospital. 22 of them are on ventilators. I have to say that's the national ratio. You have about a third of the individuals on ventilators. Why is that important? Because we want to make sure that we have the right personnel and the right equipment and ventilators available so that we can provide life-saving treatment to every New Mexican who might need that. And what's the best way to manage that is to not have people get COVID-19 and need hospitalization or critical care or ventilators. But we track it, and we want to make sure that you know that we're doing that. We have 217 individuals who have recovered. Unfortunately, we had another death today, a woman in her 80s. It is part of a nursing home cluster that brings our deaths to 17. It is the most painful thing for me to talk about. I know unequivocally that these are families that didn't get to say goodbye, quite frankly, because these are families with residents in nursing homes. It means that they've been following the state's protocol, limiting all visitation that wasn't end of life or hospice related, being very clear it was only direct care and getting deliveries of necessary supplies to provide safe, quality 24-hour care. So all around the country, and New Mexico is no different, than when we have an infection and we lose someone in a long-term care facility, that likely means that family members didn't have access and didn't get to say goodbye, not just in that during the infection, but many, many, many weeks before that. And I can't imagine the pain and difficulty for these families, which is why we take so seriously making sure that New Mexico does everything it can to prevent the spread and to save as many lives as we can in our state. And I thank you for all that you've done. But we're going to have to do more, and you're going to see that throughout our presentations. I'm going to ask Secretary Kathy Kunkel to do a testing update next. Then it'll come back to me. I'm going to talk to you about what we've done and what we're continuing to try to get done for New Mexicans as we all embrace that we have to do this together to beat back COVID-19. Then we're going to talk about where we're going, and we'll get a modeling update from Secretary Dr. David Scrace. And then I want to tell you what to expect next, and then, of course, we'll take questions. All right, thank you very much. Secretary Kunkel.
Thank you, Governor. Good afternoon, everyone. Today we've done 25,241 tests. And in New Mexico today, in our 2 labs, we tested 2,751 people. That's really exceeds our current ability, our capacity at TriCor and the state labs, but they're working round the clock, and they continuously test anything that comes in. So we have been able, thanks to our expanded criteria for testing, to move into more of our congregate settings. And last week we spent time doing surveillance and contact tracing in long-term care facilities like nursing homes. We were in detox centers, and we moved into several tribal communities. Again, both doing contact tracing and sometimes doing surveillance, which means we're just looking for COVID for people who are symptomatic. Because we have expanded the criteria, we needed to expand our lab capacity, and this week saw some great strides in that area. Thanks to our aggressive pursuit of equipment and supplies, the state laboratories have 2 new machines. We thank the state veterinary school for loaning one of them to us, but those 2 machines should be up tomorrow, which will increase our capacity. We did receive 15 Abbott rapid tests from the federal government. Those will be deployed to rural hospitals. We did not receive a significant amount of resources to operate them. So we have a very limited ability at this point to deploy them, but we will deploy them to hospitals who can do rapid turnaround for healthcare workers or for individuals who are hospitalized and they need to make room for other beds. In addition to the capacity, we have Sandia Labs has successfully started testing today. We're very, very proud of that partnership. Lannel hopes to be up and doing testing again in the next week, potentially. They are also dependent on this supply chain, though, which has slowed their progress, but we see them coming on board very soon. And in addition to our internal state capacity, the Department of Health is contracting with some sister states who have some capacity they can share with us. And we're also looking at contracting with large national pharmaceuticals who have, again, their own supply chain. The biggest limiting factor for us is not our instruments or our personnel, it's the threatened supply of resources. So we are looking always for ways to enhance that and back it up. And I have some other thanks today. I want to thank Secretary Hotram Lopez, Secretary of Aging, for joining the Department of Health and taking on responsibility for our long-term care facilities. She's done a fantastic job. I'm sure that Secretary Scrays has more to say about that. And I want to thank our private partners who have taken us to, I think today we had 51 sites in 28 counties. On Saturday, we'll be in 31 of 33 counties, and by next week, we will be in 33 counties. So I thank our private partners, and I particularly thank the Department of Health Public Health Division, who are out there every day, who go out to all these sites, and they also are available to do immediate investigations and set up sites in places that we think are hotspots. So thank you all very much. You're doing a great job. Thank you.
All right, thanks. Back to me, and then I'm going to do a clarification. We're not partnering actually with national pharmaceutical companies, but large, big box retail pharmacies, and that's critical because here's what's going on. Just like the personal protective equipment, states are on their own to broker and figure out ways to get supplies in so that whatever your laboratory instruments are, that you have the sampling on the front end and what we call reagents on the back end so that we can pull out, right, figure out whether or not COVID-19, that virus, is present in that sample. There are limited numbers of companies in the United States, quite frankly, around the world, who actually produce these reagents and supply testing kits. And so everyone in the world and everyone in the country, including the federal government through the CDC, is working to, frankly, interrupt these supply chains. So here's what we've done, I think, really effectively. is that we diversified, right? No wrong door. We didn't focus on the federal government having testing supplies and running them through the CDC. We didn't focus on just Indian Health Service. We partnered with them. We didn't just work with our state lab that belongs to every New Mexican. We didn't just focus on the University of New Mexico Hospital or their research institutions. It was no wrong door or large private laboratories. We're utilizing everyone. And as we do that, we're figuring out expanded capacity and independent supply operations to each of these entities or organizations who have always had the licensed ability to do this testing. So the key here, we think, to successfully dealing with COVID-19 is broad-based public-private partnerships, continuing to leverage our expertise, and wanting and inviting every single partner to the table. So I want to thank the Secretary of Health for doing that, quite frankly, as aggressively as she has, and it's really paying off in our state. All right, so what have we done? What have we accomplished? I know that many of you are aware that we've extended our stay-at-home orders, and I know it's really hard. It gets increasingly difficult to meet these stay-at-home instructions and also to make sure that our business partners are clear that we're really working hard to keep folks from congregating in any number of businesses, because that defeats the purpose. Movement at all creates risk of transmitting COVID-19. It's as simple as that. So we have metered at our big box retail stores, and what that means is that maximum 20% occupancy. We have created additional closures to limit non-essential businesses. So we did that to liquor stores, in-person car sales, and payday lenders. We believe that we've created the right kinds of additional vehicles to make sure that individuals can cash their checks and deal with their day-to-day financial needs, but we're not having the renewal of and engaging in additional loans or practices by having these, what we think are non-essential businesses open. Now, we're going to keep doing that. The other thing that was on that slide that I want to draw your attention to, we don't have to bring it up again, but we're also enforcing. So the state police have put out 15 cease and desist orders. That means they've gone to businesses who have either mistakenly misunderstood, and we can work with that, these orders, or who violated the orders and stayed open. Nobody wants to slow down the economy in the context of hurting any small business, but we will take every precaution to make sure that we're saving lives in this state. It is the right work. And where New Mexicans continue to congregate, we're going to keep looking at ways to provide the narrowing of those efforts. And the way we do that is we're going to provide citations. And people should also expect that if New Mexicans are violating our stay-at-home instructions by not just going to essential businesses and medical appointments, then we're going to let you know that you're in violation, and that can be a misdemeanor and a financial penalty. So if you're congregating with 20 or 30 others on a bicycle ride or a motorcycle ride or a picnic, you're in violation of our no more than 5 and instructions to stay home. And we've done everything that I know to get folks to comply. And so if you can't comply, we're going to let you know by making sure it's clear to everyone that we will enforce, because we have an obligation to save as many lives as possible, and this is how we do it. Next slide. So what should, perfect. So I also want to talk a little bit about what we're doing in terms of recovery. I want to make sure that while the focus of these press events, so that we're providing information, is to tell you what's going on related to COVID-19 directly. We also want you to know we are clear that small businesses and individuals in New Mexico are fearful are losing their jobs, are losing their benefits, and we're continuing to see numbers of individuals laid off and businesses shut their doors. So we're working diligently to make sure that we can do everything in our power to prevent that and to shore up our small businesses. So this week we've launched something called the State Investment Council has a loan recovery fund. That fund is intended to provide low interest loans to mid-sized companies, so at least 40 employees, and we believe that we can do up to $10 million per loan. I know that folks are talking about loans aren't as helpful as a grant. We're clear. If we don't have the power to issue grants, we do have the ability to get folks leveraged until we can build the economy again. And maybe these loans will make more sense over the long haul. But for right now, we need you to stay in business, and we want you to keep your employees employed. Next slide. This slide. Oh, there we go. All right. Workforce Solutions. Now, this is the department that provides unemployment benefits, and I want to talk about what we've done. We've expanded our call center hours, so it's 7 a.m. to 7 p.m. We're doing that 24/7. And while on the slide, if you want to go directly to Workforce Solutions, you can go to jobs.state.nm.us. Jobs.state.nm.us. You can also go to our New Mexico government website, and you can navigate directly to Workforce Solutions from our overall website, where we're trying to, and we're doing, I think, an effective job, making sure that up-to-date, meaningful information about what's going on is available. And I want you to know that we've waived the waiting week. So we can do that by making sure that you don't lose a week of benefits, and we're trying to make that retroactive to folks who didn't get the benefit of that and lost a week of income. We can take that all the way back to March 15th. We're creating an environment where there's sort of an auto adjudication. I want to talk a little bit about this. These websites, or these, it's not even a website, the software that states, including New Mexico, uses are often websites that were required by the federal government that in more cases than not were intended to screen people out of getting benefits. Now, frankly, even under the best of circumstances, I don't think this is an effective tool to provide the benefit that, frankly, we all pay into, that is intended to keep families whole to the highest degree possible when they have an unexpected change in employment. So these systems are a mess, ours included. So we are making the kinds of adjustments, we're changing things in a way that makes this more user-friendly, that makes this a state that leads in terms of protecting New Mexico workers and families. And if you've been frustrated, well, we share that, and we apologize that this system couldn't meet the growing demand, but you should expect us to do much better and to create a system that will work when it's hard, and to create a system that will work when we have low unemployment numbers. And the last thing that I want you to know about this is you've probably seen us announce that we found a little money that's not tied to some of the federal stimulus money that's coming into the state the last couple of weeks in April. We hope it's the first of large investments for hospitals, small businesses. Individuals should expect to receive a stimulus check, about $1,200 per person. Families and dependents get a little bit more. They should. But we found a way to give, kind of on a first come, first serve, spending up to the $1.5 million, about an additional $750 on top of what's coming from the federal government. Because we're clear that that $1,200 isn't enough to buy food, pay a mortgage, keep the lights on, and or pay rent. We're clear. So we wanted to provide an additional benefit and that unemployment weekly check. We're going to look for more resources. We want it available to everyone who should be able to benefit from those investments. And I wanted you to hear it from me. I don't have that lined up exactly yet, but I am highly motivated to find it. We shouldn't be offering programs where some folks get in early enough and some folks are left behind. We are all in this together, New Mexico. And while I want to applaud Workforce Solutions for making sure that we've got money, let's get it out there. That was the right decision, but the best decision is making sure that we provide as many resources as we can to provide income security to New Mexicans who are not feeling very secure about what the future holds for them. And I want that to change. I want everyone to feel like we're going to do everything in our power to protect you, to safeguard you, and to pay attention to the issues that you struggle through every single day. All right, next slide, and I'm almost done. These are some more loans, and I just really want to point out we're having webinars. We're going to continue to specify how these programs work. We work through any number of both federal partnerships or through our Economic Development Department. And while the vast majority are still loans and counseling programs, it gives us insight into the needs of New Mexico small businesses so that as we get what they're calling the CARES Act, right? It's investments into small businesses and workers. We're clear about how to manage those investments so they have the greatest impact and the least amount of bureaucracy and red tape in order to actually get those. So I wanted to give you a sense about that. And something that we've just started, Buy for Tomorrow today. BuyNewMexicoLocal.com. Look, anything that we can do that shores up our small businesses, that keeps the purchasing power alive in our state, we should be doing. I want you to pay close attention to that. And for those of you who can support that initiative, please do so. Next slide. All right. This is more COVID-19 specific in terms of protecting us from transmission and also being really clear that we need to do more for individuals who are COVID-19 positive. So we now have several self-isolation sites. We've got 5 statewide that we currently have individuals. So these are first responders or healthcare workers or other individuals because of the extreme risk in a community really need to be isolated somewhere else. So we have 5 of these sites in the state, and we have 8 more that have been identified. We expect by next week that they will be available. Today, without the additional 8, we have the ability to provide rooms, and you can see here that we provide room and food. Actually, what's not on here, laundry services. We really create an environment where you're protected, we're protected, but we don't leave you there by yourself. And in fact, our Behavioral Health Services Division do routine check-ins. We know that being removed and isolated from your family is an incredible hardship and sacrifice. And again, New Mexico, we are all in this together. We think these self-isolation sites are an incredible opportunity and tool to further protect New Mexicans. And one last thing, and I want Dr. Grace to talk a little bit about it, but we're also creating long-term care COVID-19, a site, potentially more coming. And again, it's to protect residents in a particular nursing home where we might have a COVID-19 infection. And it's also to make sure that the highest quality of care and support can all be co-located into a long-term care environment. I want to thank all of the geriatricians and direct care providers who have lent their expertise in putting this together. We think it's going to be a best practice model, and don't take lightly the complexities associated with such an effort. So thank you all so very much. I'm going to now turn it over for what we're doing and to talk a little bit about that modeling. Dr. Grace.
Thank you very much, Governor. And today I'm going to go through another series of slides. They have a lot of data on them. And we are working hard, actually quite hard this week, to try to connect our information systems so that virtually everything we show you today you'll be able to see online in almost real time every day. Setting up the system on the web isn't the hard part, it's actually connecting data systems to provide it. And so hopefully the next time we do this, we can just page through internet sites and show you where to find this information. So the first slide is a map of the distribution of COVID cases per 100,000 people I think I confused people a little bit last time, so let me explain how this works. We take the number of cases in your county, and then we take your population and divide that by 100,000. So if you're in a county that has less than 100,000 people, this number here will be bigger than the number of cases you're used to seeing. And if you're in a county that has more than 100,000 people, like Albuquerque, that has almost, Bernalillo County has almost 600,000 people, the number here will be 1/6 of what you'd see. And the main reason I'm showing this slide today is to just, again, to call your attention to the northwest corner of the state. Our statewide delivery system effort is very focused there. Right now, you can see very high numbers for San Juan, McKinley, and Sandoval. And in fact, as of today, which I don't have the slide updated for today because we just got the data, but San Juan is now at 98, and McKinley and Sandoval are both over 100 cases per 100,000. We've got 118 in McKinley and 120 in Sandoval. Those are getting to be high rates. And as we go through the rest of the presentation today, I'll be coming back to this part of the state to let you know more about what the team is doing to do that. The next slide, I think, answers some questions that came up last time. Every time we show a number, people want to know all the numbers that go into that number, and that's great. And so here are the total number of cases as of today broken down by age groups, and you can see sort of 20-year age groups here. And a couple things to point out. Number one is that at first people were very surprised that younger people were getting COVID infections. They were not expecting that, but that actually the cases are very equally distributed between the ages 20 and 80. And so that's something to be aware of. It is the case that older people are more likely to be symptomatic, and we'll talk a little bit more about that as well. By gender, we're seeing a trend on the next slide of a little bit more disease in women than in men. The unknown are just brand new cases that we're tracking down and getting additional data on. And so it almost even, but a little bit more common in females. And the next slide will show you death rates in the world, in the United States, and in New Mexico for people with test-positive COVID infections. Now, initially, you might think we should be really optimistic because we're way lower than other reported death rates, but we at New Mexico are still early in that curve. We're early in the infection. Secretary Kunkel and I were talking today about how today is day 30 for COVID here in New Mexico, and that is still early, and because of the efforts people are doing to keep the social distancing, we're actually making progress. I want to talk about deaths as well, because this is where people get the impression that COVID is a disease of older people. And so on the next slide, you'll be able to see the deaths through excuse me, let me do this slide first. This is a slide that shows, that I've showed before. And so on the upright axis, the y-axis, you've got the number of cases. And on the x-axis, the horizontal axis, you have the number of days. And in these graphs, down is good. And so you can see that New Mexico is still running in the bottom of the pack. That's where we want to be, and it's where we want our numbers to be. And so I will, I'll show you another slide that explains why that is next. Now, last time we talked about doubling time, and just as a reminder, the doubling time is the number of days it takes for our number of cases to double. And so last time, someone contacted me after the presentation and said, so that's great. If we went from a doubling time of 2 to a doubling time of 4, that means we'll cut the number of cases in half. And that was in the right direction, but it's actually quite far off. And if you look down on the graphic here, if we had continued to have a doubling time of 1.94 in 30 days from that very first case, we would have 45,196 cases here in New Mexico. If we continue, if from the first day we'd had a doubling time of 4.12, after 30 days, we'd only have 155. So this doubling time, which is related to social distancing and staying away from other people and lack of transmission of disease, is really an important number, and we are doing well on that. You can see it's plateaued because we've had a bit of a surge in cases, both in Bernalillo and in the northwest part of the state. But nonetheless, we're way better off with a doubling time where it is, and it's one of the better ones in the United States right now among states. On the next slide, a little bit of a complicated graphic. I tried to simplify it, but remember last time we talked about the fact that how many medical beds, how many ICU beds, how many ventilator beds, and how many deaths we have in New Mexico correlate highly with the social distancing. And so you can see that the highest intervention, if we just locked everyone in their homes or done some things like other countries have done, we would need a lot less resources because a lot less people would get sick. And you can see at the bottom, if we did no intervention, it would be way, way worse. And right now, unfortunately, we're somewhere between low intervention and moderate intervention. That can improve if we all take seriously social distancing, stay away from crowds, select one person to go to the grocery store every 2 weeks instead of taking the whole family every other day, et cetera, et cetera. I also wanted to update people while we're looking at this model slide about what we've done differently. I did want to thank Jason Mitchell, who's the Chief Medical Officer of Presbyterian. He has spent an enormous number of hours along with his team building a model that's more specific to New Mexico. Some of you may have seen it's called the Washington model, or IHME model. That's predicting a slight decrease in deaths. You can see that the numbers in parentheses are what we said last week, what we said this week, a little bit lower in every category, which is good news, but we still believe that the Washington model is way off, and probably off by a factor of 8 to 10. And we are able to put our own state's data in every day and update this model every day. We've also, we're now able to measure the transmission rate. We have a model now for each county in addition to the whole state. So the state model is now all the county models added up into one model. We've worked with a database from Johns Hopkins to put the health status of people in every county into the model. And we've even added social determinants of health. Dr. Mitchell and his team did that last week as well. Things like access to housing, food, medical care, and the like, which enable us to even more accurately predict what's going to happen in each county and predict these surges. So I showed this slide last time. We'll go to the next slide about what the gap in resources was. And if we were at that moderately high intervention, which we're not quite there yet, but we're making progress. You could see last week we said we were going to need 1,586 more ICU beds than we had currently available. This week it's 1,232, so we're moving in the right direction. It's really good news, actually. And as we start getting more resources and hospitals expand their ICU beds, as hospitals expand their ventilators, we'll also put that in the equation, because what we're trying to do is turn all those red bars into green bars where we have a little bit more than we need to meet the surge that's coming soon. On the next slide, I'm going to move on here. This is a map of how our medical advisory team has organized itself in the state. We have over 100 people, many of them physicians and hospital leaders organizing it. There's a lot of lines on here. It's a little complicated, but what you can see is their regional hubs in Farmington, Santa Fe, Roswell, and Las Cruces. And those hubs are working with those hospitals that feed into them, so we can plan how people are going to move. And we can plan in advance what that flow will be. In a normal situation, a doctor in, let's just say, Hobbs could give a call to Roswell or to the university or to one of the other large hospitals in Albuquerque and see if a bed was available. But in a pandemic, we don't have that time or resource. We want doctors and nurses taking care of patients and not making phone calls. And so a call center is coming up early next week to manage all these transfers. The regional delivery system is really working on this, and there are meetings that happen every day to coordinate efforts and make sure that these hospitals know how to work together and setting up the transfer system. Also, Major General Jeff Clark, who's retired and has been working with HSD, is now leading our effort on alternative sites of care, which include additional resources for the hospital in Farmington, building actually a 50-bed facility in a high school gym in Gallup. Work is already underway on both of those. In Albuquerque, we mentioned last week remodeling the Gibson facility, and we are really excited about the work that Secretary Hotram Lopez has done just in the past several days to actually negotiate an arrangement. We don't have a final contract, but we'll announce that next week. And that COVID-only nursing home will serve two purposes. One, if someone's in a nursing home and turns out a new case of COVID, we can move them to the COVID-only nursing facility to protect the residents around that person in their former nursing home. But more importantly, during the surge, that COVID-only nursing home will be taking folks out of the hospital who are coming out, generally older people who really require nursing home level of care, and they'll be providing that service. I think the work that's been done in that hub and spoke model I showed you and everything else that we're doing that's been mentioned today is just an amazing level of cooperation between the public sector and the private sector. And we've really seen hospitals all over the state step up to try to participate in this and coordinate this for the future. Next slide is just another update. These are the number of available intensive care unit beds in the state as of today. And so we monitor that every day by county. And on the next slide, I think you may see a graph of that. So actually this is good. What you're seeing is that the number of occupied ICU beds is going down. We've no longer doing elective surgeries, so people who might have had a heart operation no longer taking up those ICU beds. So we're trying to get as ready as we can and build as much capacity as we possibly can to be ready for this surge that's coming. The next slide sort of wraps this all up, I think, for you all. Number one, the peak is the highest point of the curve. And our models and actually other models that are out there are kind of converging on New Mexico, that the peak could be as late as late May. But that date, what we call the surge date, when hospitals at their regular full capacity, we believe is coming up in the last 2 weeks of April, probably somewhere between the 3rd and 4th week of April, so that we've moved that up a little bit. Some hospitals will see that earlier, as we're experiencing in Gallup and Farmington, and some hospitals, for example, those in places that don't have any cases yet, will probably see it later than that. And really with that, I just want to point out that everything that we're doing to prepare, it will be very helpful, but the most significant thing that the delivery system in New Mexico can do to prepare is to ask all of you to practice that social distancing, stay at home. Please stay at home. And now on social distancing, I want to show you two charts. These are actually both come from data that we're getting from Descartes, a lab here in New Mexico that we've been working with to produce this data. And the one on the left is what you sort of see on the internet when you go out there. Green is good, and that green means that people are making a much bigger decline in their mobility around the state. Again, this is data that comes from millions of cell phones, and we don't know whose cell phone is whose, just to make that clear, but we monitor the general movement around the state. And if you look at these report cards comparing state to state, New Mexico generally looks pretty good. And in fact, just to take one example, Bernalillo County, it would appear that they've reduced their mobility by 94%. But if you go to Bernalillo County, if you drive on I-25, if you drive on I-40, if you go anywhere 10 miles from the Big I, you know that actually that's not really the case, that people are still out and about. And thank you to everybody who isn't. Thank you, thank you, thank you. But people are still out and about. And as we dug into the data with Descartes, what we found was actually this median, which is the middle person. You know, if you have 101 people and 51 of them are staying at home, and the rest of them are out and about on trampolines or playing football with each other or in large social gatherings, that the data comes out to show that the median is that 51st person who's not moving. So if we go back to the chart, that's why we're getting those numbers so low. And infection still is transmitted if that other 49% of people are out and about. So what we did is and I'd be happy to talk with people offline, because you're not watching this today for a statistics class, But we decided to go with the mean. We took out any cell phone that moved more than 50 miles in a day to selectively remove the supply chain and truck transportation, delivery transportation in the state. And unfortunately for all of us, New Mexico goes from a general internet reporting site of a grade of a B down to an F in average. Los Alamos, good job Los Alamos, they have more than a 60% decrease, but the rest of us still have quite a ways to go. And this is why we still emphasize this so much. It is the most important tool we have in our armamentarium to stop the spread of this disease. And so I'm going to conclude with the last slide, because this leads into it. So I told you before, we're somewhere between low and moderate, but New Mexico really needs to be somewhere between moderate and high social distancing interventions, which means that everybody has to find ways to cut back your activity, to stay at home, and to prevent a surge that you can see in the low intervention model. It would be horrific. In the moderate intervention model, it's going to be a struggle. And actually, in the high intervention, we could handle this and provide the best possible medical care for every New Mexican. So, as I always conclude, please stay at home.
Thank you, Dr. Scrace. So I think we continue, I know we do, to really hit hard that the only way, we save lives, and those lives are healthcare workers, first responders, any number of individuals, in addition to our loved ones, our families directly, by staying home. And it's not happening. The F that you saw is a real indication that we are spending far too much time in our vehicles, at the grocery store, convenience store, at the hardware store, and we can do better. And we're seeing far too many people in parks and doing leisure activities in large groups, and then unfortunately posting about it. And while I understand that social distancing and self-isolation is incredibly challenging, I am really disturbed by the notion that any New Mexican would highlight the fact that they're in direct violation of our efforts and our orders, and that they put somebody's life at risk. And in fact, I want to talk a little bit about that. Those lives that they put at risk is this life. Now, this is a picture of my mother and I talked a little bit about her. Her name is Sonia, and Sonia lives in Albuquerque, and she lives in an assisted living facility because she needs 24-hour support, and I was not able to do that anymore. And we have a very effective partnership, my brother, my mom, and I, so that she gets the best set of services and efforts because we're working together. Now, I haven't seen my mom in 6 weeks, neither has my brother. But if you're out and about, when the caregivers and the nurses and the doctors who are coming to that particular facility where she lives have been to grocery stores where too many people have been, and have been at a gas station where too many people have been at a park where too many people have been, then the life that you could destroy could be mine, because I could lose my mother. And so I think about my mom every time I have to make a tough decision about restricting where we go and where we can go. It is all about making sure that we save lives. And I think we've got another photo I also want to show you. Can we get that up? Well, can we get it up now? Because there should be no more slides. Here we go. So I want to introduce you to two individuals. And I want you to see this photo because this is a doctor and a nurse. The nurse is Jenny Rodriguez and the physician is John Marinaro. And first I just want to highlight what incredible individuals we have in this state. So these two incredible healthcare professionals who are helping us plan and prepare every day day, but know what's coming and know the risks they take on our behalf, and do so competently, expertly, and willingly. All they're asking is for us to do our part. Just took ventilators to Farmington and then provided direct care support and training to make sure that every single individual and healthcare provider gets everything that they need to do to protect New Mexicans, no matter where you are. And so before I go to the grocery store, or I go to a gas station, or I come to a press event without my do-it-yourself mask, I think about these two, about their families, about their sacrifices, about their dedication, and about what it would do to other New Mexicans if one of them got sick, or God forbid, because we didn't do enough, that one of them was in a situation to potentially lose their life. It's unacceptable. And the reason that I'm doing that is we've been on the phone every day, and I want to thank, again, I'm going to do it again, I want to thank all of the faith-based organizations who have voluntarily, so we don't have an order, they're excluded and exempted, because well more than 90%, the vast majority, have been doing any number of faith-based services on the telephone, via Zoom, on the internet, where people drive in their cars but don't get out, and just sort of feel that solidarity of love and faith by coming to their place of worship. I want to give a specific shout out to Calvary, who has an incredible faith-based following, and they're really making any number of sacrifices to both support their members, but to also stay in concert with what we're asking in terms of social distancing. They have, and so Pastor Skip, you've done an incredible job, and I know that all of us are missing our own faith-based traditions this Easter weekend. We all are. But when we do that, and we provide and we practice our faith alone or with our families or at our homes, we are still reflecting hope and love and spirituality. We're just doing it in a way that makes sure that we are equally doing everything in our part to safeguard New Mexicans. So if you're one of those faith-based organizations, hasn't quite made up your mind, you're certainly going to hear from us, and we're going to keep making the case, because we don't want to continue to put these restrictive orders together. What we want is for New Mexicans to do it because they believe in the science and they understand the risks that we all pose if we don't take them seriously. And again, we're not trying to punish people as we're doing these citations. We're trying to protect New Mexicans. Everything we do is aimed at protecting all of us and really respecting our first responders and our healthcare providers. Next thing I want to talk about, just quickly, and then we'll open it up for questions. Now that we're concluding sort of the middle of April and moving on, and I know it's been incredibly challenging for students who don't get to school. Typically we talk about how we get our adolescents. It's difficult to encourage them and motivate them to get up every morning and go to school. Based on the kinds of calls and text messages and social media messages that we're getting, and I'm getting directly, my sense is the tide has turned, and that students miss each other, and they miss their teachers, and they miss everybody at their schools. And while you're not going to school, education is still occurring. Your educators are still caring about you, worrying about you, and excited about your education, even though you're not going physically to a school. So I want every New Mexican to think about this. These students and our public education folks and our private educators are enduring incredible sacrifices to stay connected with their families and students. And for all those students who aren't in May going to get to have a large commencement, and aren't going to get to go to their proms in the same way that they were going to get to, and aren't going to get to celebrate with their friends that they have achieved incredible success, know that we're proud of you. We know that you work hard every day, that you've worked hard to get to where you you are, that this is not what any of us expected for you or for your families, and that it's really hard, and we know that. And I just wanted to make sure that every New Mexican, you know, where you can, drive by, you know, a high school student or one of them is your very own, remember to thank them. Post positive messages on social media. Let them know we care about them, and that where we can, when we can celebrate, we're going to find ways to do that successfully. And again, I want to thank all the educators that, in spite of our internet divide and broadband divide in this state, I want to thank PBS, everyone who's really trying to provide a meaningful educational experience, even though we're not going to school. I thank you, and I know there are some challenges, and I know there are some areas that we want to do better in, and you should expect us to continue to try to do that. So with that, I want to make sure that everybody has a safe, productive, happy, social distancing Easter weekend at home, enjoying the company of your families. I want to thank everyone again for doing their part. I know that you saw the slides, that if we don't keep doing better, we will overwhelm our healthcare system. And no amount of work or effort we make together will be able to produce enough ventilators, hospital beds, and healthcare workers to meet a surge or a peak. The only way I can do it, and we're still getting ventilators, we just got 30 more in the state, we're doing it. But the only way we're successful is if we do this social distancing. So please, take heart, take heed, and help us make this a state that's very clear about our social contract with one another. All right, let's take questions, Nora.
Thank you, Governor. All right, press folks on the call, we're going to start taking questions. First up is Algernon DeMaza from the Las Cruces Sun News. Algernon, you are unmuted. Go ahead.
Thank you, Governor. We're just wondering down here in the southern part of the state if there's any new information about capacity to move some of the emergency medical resources down here or supplies down here in the event that we start to see a surge in this part of the state.
So the answer is yes, right? So when there was a slide put up, and it, again, sometimes data on one slide can be difficult to absorb all at once, but we showed that we are pushing out regional capacity. I just highlighted a physician and incredible nurse in the state that drove ventilators and training and support to Farmington. So all of our local hospitals or rural hospitals should expect that. But we're going to have a mix in our state. And that mix has got to be that if it's safer for a patient to come to Albuquerque or Santa Fe as we start to see the surging and the peak as we're modeling, you should expect that some folks will be treated outside of your community and will provide resources, including personal protective equipment, training, ventilators. We want to make sure that we're as prepared to meet the needs everywhere. But because we're a rural frontier state, where we can't, we want to make sure that we also have capacity in Albuquerque and Santa Fe to meet those needs where we have more resources. So it's a bit of both. And we're working directly with hospitals like Memorial to make sure that we are doing that collectively, and we're doing that through their own physicians as well as our medical assistants or a medical advisory team in the state, which has regional representation. Did I miss anything, Doctor?
Governor, no, but I would just also add that part of our decision about where to deploy resources right now in terms of alternative sites of care is based both on predictions for the future, but what's really actually happening right now is, if you remember that map with the very dark northwest corner of the state, we are bringing up alternative care facilities in Gallup and in Farmington because it's clear that they will be the first hospitals overwhelmed. Doña Ana still has a relatively low count of cases, but I know that the regional delivery system team is working hard now to plan for the next steps in this, and the folks at Memorial have done a great job cooperating with us to connect with the hospitals in your area.
Right. And that's one of the reasons that we went after the field supply units from the federal government. So we have a 50-bed that is operational in Farmington with another one that will be deployed in Gallup, and we are planning for providing as many resources in the communities where they need them. But I do want to be clear that as this continues to get more difficult and more complicated, because we have more cases and more hospitalizations and more people on ventilators, it's going to have to be a bit of both. But we do that with a consultation with our partner healthcare providers in every single community.
Thank you, Governor. All right, up next we have Dan Boyd with the Albuquerque Journal. Dan, you are unmuted. Go ahead.
Yeah, can you hear me now?
We can.
I'm so glad you can hear me. Governor, you mentioned a little bit this week about eventually kind of reopening the state's economy during the SIC meeting. Wanted to kind of see what criteria will be used to determine when those closures can be lifted, and realize that it may be premature at this point, and kind of what that plan might look like for reopening the economy.
Now, I appreciate that question, actually, Dan, because it is incredibly complicated. So let's talk about, and folks that we pay attention to here, right? We talked about, we pay attention to the FDA, we pay attention, I apologize, to the CDC, the Centers for Disease Control. Like most of America, we are listening and believe the scientists and the doctors, Dr. Fauci, Ambassador Birx, and I think it's an incredibly complicated endeavor. Why is it so complicated for us to say, okay, we're managing our healthcare resources, we've done our social distancing, we're having devastating impacts in the economy and in our in educational system, so we got to do something differently. Well, the big thing here is this is a deadly virus, can be. It is highly contagious, and there is no vaccine. And as we're testing different treatment protocols, there isn't sort of a universal, given these set of patient criteria, treatment protocols that have been tested in the context. So we've got a high degree. I think we're gaining some confidence on a variety of those treatment protocols, and we test those with our medical advisory team. But that's the problem here. So when you open up again, you're exposing yourself to a virus that is waiting for us, right? We're the hosts. It is waiting for us, and the way that it gets transmitted is if person to person we are near each other. So without a vaccine, that's your very first complication. So you've got folks and experts like Dr. Fauci who are saying, you know, might be a year before life is back where it's normal. And maybe it's a new normal. We don't shake hands. We get accustomed to wearing these do-it-yourself non-medical masks. So we're taking all that into consideration. The New York Times, which I think did a very effective review, and we're going to use it as one of the aspects to garner information and recommendations from another group of experts who are looking, now that we're seeing a flattening of the cases in New York, and they're looking at what that means. They're beginning to put together their recovery, which is a kind of a reopening of businesses and lessening the social distancing. And they're saying you have to have incredible resources in public health. Well, I would agree with that, and we're going to have to really talk about how we rebuild the public health system, which is taxed in our state, which also received very little support for the last 8 or 9 years. We've been building that in the last year and a half, but we're going to need more. The third thing that you look for is which businesses provide an economic relief recovery efforts provide the least amount of risk. And so that's going to look at what's their exposure to the general public. So we're going to have to figure that out. We're putting together that recovery plan, and so this was a long answer because it is really complicated. If you open too soon, you'll see a resurgence in the infection. If you open too late, we'll miss opportunities to save businesses, to provide economic security for families and individuals, and this state needs an economic response today and for the future, and we are clear about that. So we want to be able to start talking about our planning efforts and what our strategies look like in the next week. And so I hope you'll ask me that question again, but I do want New Mexicans to know this. It's not as easy as it sounds. We just decide one day that we see a flattening and then there's a decrease in cases. It must mean that we've beat back this virus and we're okay. I don't think it will mean that. I think it means that we're ready to start testing some of these ideas. And quite frankly, every state needs to support a federal effort to get a vaccine and treatment protocol so that we are clear about saving lives if you're infected, about making sure that we can prevent it by having a tested vaccine. Those are the two aspects that are game changers. And I wish there was a straightforward, easy answer, because there isn't a single American, and I assure you there's not a single New Mexican who isn't anxious for us to release these orders, these public health orders, and to try to have normalcy back in their lives and return to work. And it is way too soon to talk about when that is. But we are clear we need to start making some of those key decisions. Next question.
Thank you, Governor. Next, we're going to hear from Marley with the Gallup Independent. Marley, you are unmuted. Go ahead and ask your question.
Hello, this is Marley Shabala with the Gallup Independent. And my question is regarding the Joji Center in Gallup, New Mexico. It's a rehab center, but they take people that are unable to take care of themselves because of alcohol or drug abuse, and so they take them over to the shelter. And there was a positive case reported on Tuesday, and yet they remain open. And these clients, I'm sure that your health director is aware of, because she spoke briefly about homeless shelters and these rehab shelters, that the clients are, unfortunately, live very unhealthy lifestyles. So they are out and about in the community. And there have some of the employees, one of the employees has tested positive, and the employees aren't sure if officers were contacted who picked up the client who tested positive, and they have been receiving calls from the Indian Health Service Hospital regarding test results of the clients. But this information is not being given to the employees, so the employees are afraid after one of their comrades tested positive, and yet it remains open. Why?
Well, a couple of reasons. We haven't closed. If we were closing places, every time you had a positive ID, we'd have to, or a positive case of COVID-19, you'd be closing hospitals, rehab centers, nursing homes, and any number of critical care environments. And I can appreciate that people are scared, and having fear about this is one of those aspects that that I find incredibly troubling and disturbing, because it's real, and we need to do something to mitigate that. So here's what I know about that particular situation, and something that we are looking at trying to tighten. So when we get a positive case, we don't give any personal identifying information. Right? We take very seriously protecting that information for any number of reasons. But primarily we're required by law to do that in the work that we do for health information. That's a federal law, and we have mirroring state requirements, and we should. And we also worry about how some people might react to that, particularly when it's not true. And so there's a number of things at work here. So we aren't going to do that. But when an individual discloses, or somebody else seems to at least have some information, then getting our arms around how a community behaves, I think we can do a little bit better job. In particular there, it is clear now that when we ask people to self-isolate, and we create opportunities for particularly high-risk individuals, and what do I mean by that? They may not have a place to self-isolate. We've created safe spaces to do that. So what happens when we have an individual who might not stay in a self-isolation environment? Well, unfortunately, we are becoming aware of several instances of that in the state. And so we've provided now security measures to prevent it. We are looking at any number of more proactive steps, but something that we may have to talk about with that community is whether or not for individuals who are not taking seriously that they have an absolute obligation to stay isolated, we may have to go to a more quarantine model, which is a legal standard, and you won't be allowed to leave. And it is something that we are in communication with a variety of experts. But we're going to now increase security so that you are gently plus redirected and reminded. As for the rehab, we're providing surveillance and testing, and that's what we do at any of the nursing homes or any high-risk areas where we've gotten a positive COVID-19 case. If there was widespread issues there or anywhere else, well, the state would make incredible efforts to confine, contain, provide care, and make sure that we're doing the best standards in that environment. But we typically don't close those environments because those are necessary and needed services with trained personnel. Yep.
Thank you, Governor. And I do have information about this particular facility, and we did isolate the individual that tested positive, and the Department of Health was there today developing a response with the staff of the facility. So we do a very, very deep investigation.
Is that something that New Mexico is considering doing, is maybe using National Guard members along those state borders to remind people they shouldn't be traveling back and forth? And then along those lines, I see that the peak is estimated for kind of late May right now in New Mexico. Is there any consideration of a statewide curfew if the state experiences a really bad peak?
Everything is on the table, Chris. I will do anything I need to do that saves lives. So everything's on the table. I want to talk about a program we tried to launch and we weren't successful, and we're going to keep trying. So it's not just for travelers, but for truckers who we need to deliver groceries, commodities, and supplies for thousands of truckers who come in. We wanted to do temperatures as they were coming into the state, and if somebody had an elevated temperature, we wanted to make sure that they got tested and that we had somebody else like the guard who would either do an escort or meet them at their delivery site so that they did not get out of the truck. And we were providing then meaningful information to both the individual and that individual then could talk to their parent company and state about what they needed to do to self-isolate. Like all of these supplies, it has been incredibly challenging to get the, I call them, the temperature guns, so that you can do that at a safe distance with personnel who can gather that information. We've been unable to secure enough to meet the needs in our long-term care facilities, our correctional facilities, and in our healthcare facilities. We're still trying to do that. In the meantime, we ask them when they stop if they have any symptoms or signs. If they do, we still ask if we can follow them and unload these trucks. I mean, we're really nervous about that this virus will follow its travelers right into the state. For tourists, we've been trying to dissuade visitors and tourists, and we put up road signs saying that most of our state parks are not open, that we don't want people visiting national parks in large groups. We don't want them going and overrunning small grocery stores and little communities where they're trying to get away. We're seeing this occur, and we have agreed to help do diversions and even roadblocks in small communities that are attractive to campers and visitors. So we're already doing that with road signs discouraging, and we've agreed to support many of our tribal communities and pueblos in particular to also block where where travelers can go and put up signage that says that really we are not open to tourists and tourism, trying to dissuade travelers. I think that we can do more, and I'm talking with governors around the country about how you do that. Again, everything on the table, including if we needed to, I would consider curfews. We are hoping that as we dig deeper, using cell phone data and restricting what's identified as an essential business and how you participate in going to an essential business, we're going to hope that that's enough. But look, you've got curfews at the Navajo Nation, and in fact, many of our sovereign nations have imposed their own curfews. And so it is already occurring in the state of New Mexico, and it is a model that we're paying attention to.
Thank you, Governor. Next, I have Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go ahead and ask your question.
Hi, Governor. Long-time listener, first-time caller. I wanted to ask you about the self-employment stimulus payment. That's the $750 one-time payment for self-employed people. Looks like Workforce Solutions had some difficulty getting that link to work. It was delayed for a day, and then today, at least according to folks on Twitter, within about 5 minutes, all 2,000 of those first come, first served payments were gone. I'm wondering what the administration can do more, and also how it can do better in terms of getting money in people's pockets.
Yeah, I love this question, and thank you, Matt. I really want to applaud. I'd love to take credit, right? This was the governor's idea. We're trying to make sure that we're front-loading and also taking care of individuals that may not see relief in the CARES Act or the stimulus package that's coming in from the federal government the latter part of April. But this squarely was the idea of the Secretary for Workforce Solutions. So Secretary McCamley saw that he had, and it's tough now. I mean, we're providing any number of emergency response government services. Money's not coming into the government, of course, because people are not employed and businesses aren't able to do their business. And we've seen a huge downturn in the global marketplace, which has had incredible negative impacts on our energy economy. So it's tough for us to find that we have any leveraging room at all. And he found leveraging room, found $1.5 million, and wanted to immediately put it out. So it's troubling that we couldn't get the IT to work the way that we intended, or that we didn't expect the kind of volume that we would get, because people really need these resources. So we apologize to New Mexicans for that. We can and will do better. I talked a little bit, Matt, early, that a lot of these workforce solution IT systems were designed to screen people out, so they can't deal with huge capacity. You know, we've got 64,000 people who are in that benefits queue, and so it's incredibly challenging. It's still our obligation to fix it, and you should expect us to. So here's what I said on the front end. We will find additional resources. I don't know where we're going to find those, but we are. We can't have programs, although I applaud getting the money out, where some people can get through, right? I feel like it's when they would do an airline special, and we'd all try to be the first 10 to get the getaway fare. That's not how government systems ought to work. They really shouldn't. We need to be able to apply them to everyone. But again, Secretary McCamley found resources, and he got them into the hands of a ton of folks. And I really applaud that effort. And now New Mexicans should expect, in short order, we will find other places to leverage and make sure that everyone that meets that self-employed criteria gets that $750 benefit. Shout out again, but we need to do better and do more. So that's what New Mexicans should expect.
Thank you, Governor. Next, we have Mayra Aguilar with Univision. Mayra, you are unmuted. Go ahead.
We applaud that effort, and now New Mexicans should expect, in short order, you will find other places.
Mayra, if you want to go ahead and mute your feedback audio, and I'll unmute you so you can ask your question. Okay, Mayra, you are unmuted. Go ahead.
So that's it.
Okay. We don't have Maida. I'm going to go to Morgan Lee with the AP. Morgan, you are unmuted. Do I have Morgan? Morgan, do we have you? Okay, I don't have Morgan. We're going to go to, I'll have here, Celia Rainey with New Mexico In Depth. Celia, you are unmuted. Go ahead and ask your question. All right, I'm going to come back to you. I'm going to go to Hannah Grover with Farmington Daily Times. Hannah, you're unmuted. Do we have you?
Yeah, thank you so much. Our question was, President Nez continues to mention how FEMA, the Arizona National Guard, the U.S. Army Corps of Engineers, and now Team Rubicon are assessing communities to find places to house temporary medical shelters, including in areas like Shiprock and Crown Point. So we were wondering, are any New Mexico state departments involved with that setup? And if so, in what ways, and what are the current plans?
The answer is yes, and so we were in negotiations and communication with President Nez and Vice President Leiser of the Navajo Nation. More than a week ago, they suggested that we stand up what I'm calling sort of triage centers. So food and water supply and delivery, healthcare triage and support. If we need to come in with IHS, and I think that we do, to expand testing opportunities, that we do all of that, and it minimizes individuals, the need for them to travel into other communities like Gallup and Farmington. And again, it's not that anyone in the state is not welcome. They're welcome everywhere. How does this virus travel? With you. When you leave your home, and even when you have to do it for essential services and benefits. So we're clear. The National Guard is ready to stand those up. So we've gotten, as I understand it, the right personnel, and I mean, that's all part of the planning. Who's going to go? When do they start? Where do they stay? How does that triage center look? And it should mirror what's going on in large part in Chinle, Arizona. But yes, we're going to be doing that in partnership, and the lead entity for the state is the National Guard and our Emergency Operations Center, but it will be stood up with the support of the Public Health Division, support from the Human Services Department, and support from everyone in state government who's working collectively to make sure that we're meeting the needs of every single New Mexican. And we're doing National Guard setups in much that same way, not just in Indian country in New Mexico, but we are really focusing on the Alamo chapter at Zuni, San Felipe, at Okewinge, at Zia, at Santa Ana, and a number of places at To'Hajiilee, where we know that if we really want to support these communities to do social distancing and self-isolation, and they want that, then we have to bring services to these remote and rural areas, and we are. And we'll put that plan up on our website. It should be fully developed by tomorrow morning, and you should expect to get that. And Nora, would you make sure that we get that directly to them so that they don't even have to look? And I appreciate the question very much.
Thank you, Governor. Next, we're going to go back to Morgan with the AP. Morgan, you are unmuted. Do we have you?
Whatever Dan Boyd did in the last press conference, he's now doing it to other people.
Morgan, I'm going to come back to you. I'm going to go to Julia Goldberg with the Santa Fe Reporter. Julia, you're unmuted. Do we have you?
Yes, you do. Let me just get Thank you. This is Julia Goldberg with the Santa Fe Reporter. I've got two quick questions. The first, Governor, if you could tell me, I've been hearing from several nursery owners today who say they're seeking clarification about losing essential service status in your latest order. I was hoping you could just confirm that's true and maybe clarify why they're closed when the garden centers at the big box stores are not. And then Dr. Sprace, I was hoping you could quickly just tell me what type of epidemic model the state is using and give me your opinion on the University of Texas Austin model the New York Times recently used to show hidden transmissions. And for example, projects that there's a 100% chance that Santa Fe is in an epidemic. Thank you.
Okay, let's do well, usually I do the last one first, but I'm actually going to focus on your first question. Yes, nurseries were identified. And again, we're trying to, restrict where New Mexicans are going. And I am clear it's a hardship on these businesses. The big box stores are required, like Home Depot and Lowe's, and I'm not Lowe's, and I'm not trying to single them out. Walmart, Target, all have areas where you can buy nursery items, trees, shrubs, and supplies for planting a garden, etc. We are asking them to only be at 20% of capacity and to really focus. And the reason those hardware store, big box stores in particular, are open, because construction, highways, roads, and folks who are doing plumbing and utility work have to have access to those hardware stores in order to meet those essential services. However, if this metering isn't taken seriously, those big box stores that also have nurseries will be cited and held accountable. I made that clear, I thought, or I hoped, at the front end. And if we need to restrict what those stores are able to sell, we will certainly consider that. That is occurring in some other states. We're just trying to get New Mexicans to model the best possible behavior and to limit where they're going, because that's how we minimize spread. So yes, it's true. That's the rationale. And I'm expecting those big box stores to understand the sacrifices that our just nurseries are asked to undertake under this set of circumstances and this public health emergency. And if I can't make that work productively, we will undertake another set of decisions. The Austin modeling, we actually look at as much of that modeling around the country as we can. I can tell you that every state is using their own modeling expertise. We use the medical advisory team, it's private and public scientists, research, docs, and the national labs and private laboratories like Descartes Labs. And we're using data every day that we get. The data points that say Texas used for that modeling or Washington State used, we're at a point of time that no longer exists. So we've got real data. That's why we challenge that. Here's something, though, I do want to say, and I'm sure Dr. Scrace is going to want to add to my answer. Everyone in this state should be treating this virus as if they have it. All right, and that you are exposing any number of individuals. That's how we prevent spread. There isn't, I don't think, anyone working on the modeling or the public health response or the containment strategies that believes that the only people in the state who are COVID-19 positive are the individuals who are in our positive COVID-19 count. That's a reflection of testing. It's a reflection of people who have symptoms or who know or believe that they've had an exposure. Reality is there are far too many people in the state and in the country who are asymptomatic. And because we don't know enough about this virus, really figuring out who those folks are and what we can do about it, more than social distancing and self-isolating, is really complicated. Do I think it's as high as what the projections are at Texas? I don't think so. But unless I tested everyone in Santa Fe, there'd be no way to give you an absolute affirmation to that fact. States use a number of percentages from, 25% at the low end of your population probably has this virus or has had this virus, all the way, if you include both populations, had, never knew, recovered, and individuals all the way to 70 and 75 and 80%. So it really depends on what you're seeing in the percentage of your test results. So it's a hard thing to give you an unequivocal answer. But we pay attention to any number of modeling data aspects, and I'm going to throw it over to Dr. Scrace to get whatever I missed in that context.
Thank you, Governor. Just a few little points. You asked which kind of model we're using. We're using an SIR model, which S is for measuring or estimating the percent of the population that's susceptible. I is the percent that are actively infected, and R is either recovered or removed. But same thing, people who have gone through the disease and no longer are infecting others. So that's the type of model. I would say that one of our biggest challenges in our modeling is responding to all the questions about other models, because in our model, we're able to go in, change the variables, make it very specific for New Mexico counties, but the vast majority of the other models just show up on the internet. There's some graphs there, and we can't get in and manipulate and determine whether they've just taken the normal demographics of a Texas population and applied it to us or not. But we keep looking at them all. And I think no one should be surprised that all of New Mexico is in the middle of an epidemic, a pandemic. We have community spread statewide now. And so, and the surge, the peak dates for all the counties cluster around that end of May time. Again, some earlier, some later. But as the governor said, you should treat every person you meet as though they had COVID, and we all should be behaving in a way as we move about as though we did. And if everyone did that, that would be the biggest and most potent intervention we can make as a state.
Thank you, Governor. Next, we're going to go back to Morgan with the AP. Morgan, you are unmuted. Do we have you? Morgan,
hi, thanks for this presentation today. Can you hear me?
We can.
Yes, sir, we can. Go ahead.
Oh, hi. I wanted to check in on the idea of a mobile army hospital, if that's still happening, when and where. And you touched on this a little bit. I wondered if New Mexico is sort of involved with state consortiums, whether it's sharing anything, whether it's receiving anything from other states. And the modeling today was talking about a peak in late May, which is very close to the June 2nd primary election. I wonder what the governor would like to see in terms of keeping that election safe and effective. Thank you.
Thank you, Morgan. So it's actually yes to a variety of those questions. So we are working on the personal protective equipment, trying to do regional purchasing and leveraging that. So we've made contact with Nevada, Utah, and Arizona. I'd like to include Colorado and Texas in that. It is something that the national governors do, and I will tell you that I could spend all of my time, and it's time that we need on just chasing supplies around the world for personal protective equipment. It is incredibly challenging. And for vendors out of the country, you absolutely have to be engaged in those negotiations at 2 and 3 and 4 in the morning, given the time differences around the globe. So we need every person that we can to do that. But it is clear that states, if we were doing that regionally, could do, I think, a more effective job at A, leveraging our resources and driving down the price, not having it go the other way. 2, being able to buy large quantities, particularly of the medical respirator masks, those N95s. And so we are already doing that, and I don't think that we've seen something come to fruition yet, but that is underway. We are working as a region now, more closely aligned, and a letter should be ready to go to the president tomorrow that would represent Arizona, Utah, and New Mexico about how we can wrap around and do better regional services for the Navajo Nation, both in terms of containment strategies and support to the nation, but also treatment supplies and services. So it didn't make any sense for New Mexico to be doing 1 or 2 or 3 things, and Utah to be doing something, and Arizona to be doing something. We should be doing it universally. And in fact, New Mexico was early in closing schools and asking BIE to do that. Arizona was later. And so we had transmission that occurred on the Navajo coordination because school was open. We also know that we had church services in any number of those states. So we're really working that if we have a regional service plan, that we can offset the differences we have between states in terms of our stay-at-home instructions and orders. So I think that that's going to be very beneficial. Yes, the 200 field bed hospital is coming. I wish I had the exact date. It is a source of frustration. I actually sent a request again yesterday to the White House saying, give it over. And we expect that to be deployed in Bernalillo County, Albuquerque area, where we know we're going to need in that surge and peak more of those resources. But the beauty of these efforts is if it needs to be someplace else, while it's not an overnight prospect to get them, to open them up and set them up, we can do that. And so it allows us to meet any number of state needs. One last state effort, you know, a field hospital, beds, equipment, supplies is now available from Washington State. And I think New Mexico's competing with several states, including Louisiana and Michigan, to have that deployed. And given those epicenter issues in those other states, I think it's highly likely that that will move not to New Mexico, but we ask all the time, and kudos to the states that are sharing ventilators. And that regional work with Utah and Arizona led to New Mexico getting more ventilators through an IHS allocation than less. So it really does work, and yes, we're being very aggressive about it, and New Mexicans should expect us. I'll take every leveraging opportunity I can that protects us and makes a difference in meeting the healthcare needs of every single New Mexican. We need to do a better job, frankly, states now that food supplies for food banks somehow have been interrupted. I think that's not the federal government or FEMA, has been suggested by some media outlets, but rather there's been an overwhelming increase in demand, and so food vendors that provide those commodities directly to food banks, I think they were just overwhelmed. So we're going to need probably more state cooperation to make sure that food banks are getting what they need. And lastly, look, I appreciate that in a bipartisan, because nothing we do right now anywhere in the country should be about politics. It should be about keeping our residents safe. And I think the primaries and voting are a particularly high-risk environment. And so I appreciate that bipartisan county clerks and the Secretary of State have asked the Supreme Court for what the options are to make sure that we can safely engage in our primary voting without creating a situation where you've got large numbers of people who would have to congregate to do that. I don't have a crystal ball. I don't know what the Supreme Court will do. There are lots of national options, mail-in, more absentee work, and or moving a primary. And I know that the Secretary of State is incredibly equipped to weigh in on the law and to ask for a decision by the Supreme Court. And my office was asked by the Supreme Court to weigh in, and we pointed out that the public health efforts ought to be considered, that we take that very seriously, and there are a number of ways to do that much more effectively than the manner in which we do in New Mexico, which is great when you don't have a public health emergency and a pandemic, to have many voting sites and many locations where people can drop by and cast a ballot. So I do think it's completely appropriate that we're looking for strategies to minimize that to the greatest possible degree, and I'm looking forward to that decision by the Supreme Court. Yep.
Thanks, Governor. And Morgan, just a little bit of follow-up on Army field hospitals. I've learned a lot about this from Mike Richards, who's our leader of our medical advisory team. He's been on site in 3 or 4 disasters, including Katrina, and one thing he's taught me is that it's actually better for the patient and better for the healthcare team to take care of a patient in the hallway of a hospital in a bed than it is in a tent. And so I thought when people talked about Army hospitals that they came and put up a big structure, but most of what we're getting from the federal government are the supplies and equipment necessary to run a hospital, meds and things like that for 3 days. We stand it up. That's happening now in Farmington, inside the hospital in Farmington. And then that keeps getting replenished every 3 days to keep us going. And so same thing with the 200-bed hospital. It's not a hospital. It will be the equipment and supplies that we need for Gibson.
All right, although I'm going to challenge the good doctor.
Okay.
They do these field operations, and so because we don't have the details, it could be one or the other.
Right.
And quite frankly, I want everything that makes a difference. And then the way in which we deploy it, I expect Dr. Scrace to do exactly what he did, is to work with the experts in the state to make sure how we operate and deliver protects and supports the patient and the healthcare providers who are delivering those services. But that's, I think, why, Morgan, and thank you for the question, we have yet to get the specific details, but I do want to say that being very assertive and very aggressive for most states, including New Mexico, is paying off, and we've gotten assurances from the White House that these are available to us and are coming, and I think that they are concerned about some of the rural issues with spikes in COVID-19 and want to make sure that we get what we need to do as much as we can to protect the entire state and those communities.
Next, we're going to go to...
They can see us debate this in real time. This happens all day, every day.
Governor. Next, we're going to go to Celia Rainey with New Mexico In-Depth. Celia, you are unmuted. Do we have you? Celia, do we have you? All right, I don't have anything from Celia. I'm going to go back to Michael, the New Mexican. Michael, you are unmuted. Go ahead.
Hi, Governor. Earlier you mentioned that Workforce Solutions could be doing a better job in deploying resources to people, and I'm wondering if you can sort of evaluate their performance given this extreme influx in applications for unemployment that we're seeing. And I'm also wondering, secondly, if you can give us an update in COVID-19 cases, nursing homes outside of the Albuquerque facility where we've seen an outbreak.
Yes and yes. So this is why folks don't want to work in the public sector, because any number of these incredible professionals could have their governor who appoints them say, I need you to do a better job. Now, I do that every day. I expect, just like every New Mexican, that there's never a flaw in the system, that it's never hard to produce a service, that we never have an IT problem, that we don't exhaust the men and women who show up 7 days a week to serve New Mexicans, who are essential workers, who are coming to work, and now, we're asking them to wear masks and do all the things that they should do to protect other New Mexicans, which, if you think about it, they may not have thought through when they signed up, but I will tell you, they don't say no. They show up, and the fact that that Secretary McCamley straight up identified ways to get resources to New Mexico families who couldn't afford to put food on the table, I give him an A+. It's incredible. But I did want New Mexicans, look, it's frustrating if the IT system fails, if I don't have enough broadband, if the link doesn't work, if I have to wait a week, if I need to do it on the telephone and somebody's not there and they don't answer. It's really hard. And when I'm worried about whether or not I can make my mortgage payment, or put food on the table, or take care of my children, there's no excuses, no realities about any of this that do justice to how that must feel. So I've been really clear with every cabinet secretary, including Secretary McCamley. We have to do better. We have to understand that this is an unprecedented issue, not just here, but all across the country. And we should lead by example by continuing to lean in. And so we are going to do that. But I also want you and New Mexicans to know that when a system doesn't work, we will do everything in our power to fix it. You should expect that. And I also explained to New Mexicans that these systems were not designed for 60,000 people to need it all at once. That's not an excuse. It's just to let folks know that they were really designed, again, not to provide a benefit, but to screen you out of a system. And that's not how any of these systems should work. I want New Mexico to lead and show we're going to create systems. We're doing it at the Human Services Department. I want to give a shout out, to those workers who are showing up, who are making sure it's easier to access all of their benefits by creating changes to the way in which we were doing things so that it's more automatic and automated and user-friendly. So I appreciate that question. So again, this is really unfair. Secretary McCamley, if you're watching, you have to do more and do better, and thank all the men and women statewide who have answered the call to do more work to make sure that we get benefits in the hands of New Mexicans who need them. So again, A+ in his effort and taking on that we need a system that can do a lot better than it's currently doing. A little bit of both.
All right, I'm going to give our last folks one more try. I'm going to unmute Celia. Celia, do I have you? Celia, do I have you there? All right, and I'm going to try to Maida one more time. Maida, it looks like your audio is not connected, FYI. All right, folks, I think that is all we have time for today. I apologize to anyone whose audio isn't working. Feel free to follow up with me for your questions. So, turn it back to the governor.
Great. Let's put up the slides that show folks, where to call again. If you need to call the Department of Health, are those slides coming up? Great. All right, so I want to make sure that we always end with this. The COVID-19 health hotline, right, is 855 600-3453, 855-600-3453. If you want to go online, cv.nmhealth.org. Any other issues, we have a resource information hotline. That's 833-551-0518, 833-551-0518, or go to our website, newmexico.gov. And I'm going to end with two things, quick, because I know this takes a long time. I'm going to remind you one more time. I'm staying home for every first responder, every child care worker, every person who's packaging meals, the doctor I introduced you to, and the nurse, but my mom. Everybody's mother and father deserve us to do the very best to keep them safe. And I will do my very best. And I know that Dr. Scrace wants to make sure that we are embracing this incredible weekend, but doing it in a way that protects all New Mexicans. Dr. Scrace.
Yes, and as the governor was talking about religious services this weekend, I was thinking about my friends celebrating Easter in a much smaller group, my good friends celebrating Passover in a much smaller group. Usually it's a big table full of people, and our coworkers are sitting there with 2 or 3 people. And I was reminded of a passage in the New Testament in Matthew where Jesus says, "For where 2 or 3 gather in my name, there I am with them." He doesn't say 10 or 100 or 1,000. He says 2 or 3. And so if you can help us this weekend by remembering those words and experiencing your faith tradition with a smaller number of people, that will also help us and help you to share any potential COVID infection with a smaller number of people as well. So thank you very much for that cooperation.
Yeah, make sure that when we come back to you in a few days, we're not an F. It's really important. Look, it makes me feel better when I know that the sacrifices and changes to my personal behavior are having the intended impact. There's a lot of New Mexicans who are doing incredibly well. And for those folks who needed a gentle reminder, you've gotten it. For those folks who need a tougher reminder, please don't put us in a position to do that, because we will. We have an obligation to protect each other. We're all in this together, New Mexico. Thank you.
Thank you.